which will be a highlight of this workshop, I'm sure. A policy needs to be in place, we heard, but what kind of policy needs to be in place? And we'll have great experts to discuss this question. This final session will be chaired by Angela Diaz from Mount Sinai Hospital. She's a professor of pediatrics and preventive medicine there, and the director of the Mount Sinai Adolescent Health Center, a really globally unique program that provides comprehensive, integrated, interdisciplinary primary care, sexual and reproductive health, mental health, dental services, and health education services for teens. And that all for free, am I right to understand? We all would be happy to have such a center, and I think everywhere we should have people like Angela Diaz. So please welcome Angela Diaz.
So as they come up, I just want to say that the objective of this session is to examine systems or governance issues that facilitate or create barriers to increasing opportunities for financial and human capital investments in young children and their caregivers. And to address this objective, we have a terrific panel, all of whom are members of this forum. And we are going to start with Dr. Jody Hyman, who is an internationally renowned researcher in health and social policy. She's also the dean of UCLA Fielding School of Public Health and founding director of the World Policy Analysis Center. She will be doing a presentation on policies that support family and community investments. Then she will be followed by Dr. Quentin Wooden, who is an advisor and lead economist in the Education Global Practice at the World Bank, where he serves as cluster leader for equity, resilience, and early childhood development. And he will be presenting about early marriage and its impact in childhood development, early childhood development. Each of them will speak for 20 minutes. And then after that, Dr. Amina Abubakar will give reaction for about 10 minutes or so. She actually is from the Center for Geographic Medicine, Kenya Medical Research Institute, and is also a research fellow at Lancaster University. And after all three of them present, we are going to open for question and answers. So Jody?
Thank you to the Ethiopian Academy of Sciences for hosting this, for your remarkable work, and for bringing us all together to really solve these problems together. It's a joy to be here with you all this morning. We heard about the truly remarkable efforts being done here in Ethiopia. We also heard in one of the breakouts about Colombia. And yesterday we heard many individual country success stories and challenges. What I'm going to talk about, I hope, is complementary to that, which is whether we can, at the same time as learning in depth at a national level, see what's happening at a global level, and there are a couple reasons for doing that. One is it allows us to advocate better for resources, advocate better for change when we can look comparatively. And the second is the kind of data that it generates when we can look at policies in 193 countries and outcomes for families in all these countries allows us to figure out what works in another way. We need to look in depth inside countries, but looking across countries can give us some really good insights too. But before I dive into the slides, I do want to talk a minute about two people which maybe will help give a sense as to why policies matter as well as programs that are targeting kids directly, because I'll be speaking mainly about the policies that help parents and families invest in their kids. So one is a woman I met in Honduras. She was working 7-day weeks, often 16-hour shifts, sometimes 20-hour shifts. She had a little child she was raising on her own, And the question was how to do it. Now, if we had more time, and in the break I can tell you more about her story because she was really a remarkable parent, but I hope that just that snippet gives you a sense that unless we addressed her working conditions, it really wouldn't matter how good the programs were. And frankly, parenting skills were as important as they are, as crucial as they are, was the least of her issues. She didn't have time to be with her child, and she was barely awake when she was with her child. I visited her shortly after this wood house on stilts she lived in had burned down because after a mandatory 20-hour shift, she was so tired she went to bed, the candle was still burning, flipped over and set the place on fire. Another was a man, because I don't want us to forget dads, and Luis was, when I met him, was caring for his son. Super rare to see a dad home in this neighborhood with a 10-month-old in the middle of the day at 10 a.m. But his son had gotten sick. We talk a lot about maternity leave. We don't talk very much about paternity leave, and we talk even less about whether parents will lose their jobs if they care for their kids. But as in many countries, if he didn't go to the hospital and his wife didn't, there'd be no one there to feed the child during the day. They were part of the care system. And he and his wife alternated, but he lost his job when he was caring for this child, who, by the way, was in the hospital with pneumonia, having gotten it when the mom had to stop breastfeeding because she had to return to work early with no paid maternity leave. So each of these are examples where, real examples, sadly common examples, where what the parents could do was dramatically shaped by the policy environment they lived in. So the forum looks across areas, as people in the forum know: health, nutrition, education, social protection. I'm really going to talk about what are the social conditions that allow parents to invest in this. Basically, policies that provide parents with time to care for infants, to care for other young children, and that provide them with adequate income, including working parents who are working for their income, but how do laws and policies shape that? And then I'll end with some of the direct investments that governments make and what we know about it. I'll just step back for a minute and say the World Policy Center, which I direct, where this data comes from, we do also link this data to outcomes. So I'm going to show you the maps of where policies are, but we're able to look both globally and at individual country data to see how the policies change health outcomes for kids, health outcomes for parents, economic outcomes, et cetera. Okay, so let's start with time. So many people who are here I know are investing their energy and their resources in the kind of care parents give their children, of course, to give the children the kind of quality care that these programs help support them in doing. Parents have to have time with their kids in the first place. There's really good data that it matters. I'll just cite one fact from this as to why some of the policies I'm going to show you count. If you increase paid maternity leave by 10 full weeks, you can lower neonatal mortality by 10%. It's a very substantial impact. Now, that's after taking into account what countries invest in healthcare services. That's after thinking about sanitation and public health measures. On top of that, it has a very substantial effect. So, how are we doing in the world? Okay, so it looks like for some reason these maps are not coming through. So, it's on a Mac as opposed to, should I give it to you on an IBM? Because these are definitely on the slides I sent you. adaptable, great host team. Evidently had an IBM yesterday, but they had to swap it out today for technical problems, and now we're swapping back. So thank you for your patience. Okay, so paid maternity leave. I hope those of you, even in the back, who like sitting in the back row like I often do, can see which countries have paid maternity leave. The red ones don't. It's not much of a geography test, I'm afraid. So who is it? 187 countries have it. The ones that don't: Papua New Guinea, Suriname, a few small South Pacific island states in the United States of America, which we hope will not be red for long. But the good news about this map is actually the world is very far when it comes to paid maternity leave. There is a lot of diversity in how long it is, and I think one of the things we can learn from monitoring the data is the different benefits of how long. We can also start to understand the impact, for example, of having prior to the birth leave, as Ethiopia and a number of countries, but not all countries do. The color of the map looks really different when it comes to dads. So you might notice that all of a sudden we have a map that's overwhelmingly red. That's because most of the world does not do anything for paid paternity leave. We should worry about this. Paid paternity leave, the data is really good. This is when dads set the tone as to where they're going to be involved long term. When countries give paid paternity leave, they have a longer involvement years after the paid paternity leave. There are lower rates of maternal depression. Kids do better, but only about half of countries offer it, and of those half, only a quarter offer more than 3 weeks. There was global agreement on maternity leave. That's probably why we have such a better map. We need that same kind of global agreement for dads. There is, by the way, a growing movement among men's organizations working for this in Brazil and South Africa and elsewhere, and we should think about how they intersect with the work we're doing on 0 to 5. So this is about breastfeeding breaks. I think we're all familiar with the fact that breastfeeding lowers mortality 3 to 5-fold. It's one of the most powerful interventions we have. But it's far from as simple as just telling moms breastfeed because it's good for your babies. Most women now work in the formal or informal economy, and when you ask them do they want to breastfeed, overwhelmingly they say yes, including those who are in the paid labor force, but when they get to work they stop. So the question is, how easy do we make it to continue? Importantly, well, the good news is about 3/4 of the world takes that first step of allowing breastfeeding breaks. And I say a first step because if your place of employment is an hour away from where you live, if you have no refrigeration, if your baby's far away, that will not get the job done. But it is an important first step. There are 50 countries around the world that neither have breastfeeding breaks nor have maternity leave for 6 months. So what's that mean? That means that we're recommending, as healthcare professionals, and the World Health Organization is recommending 6 months of exclusive breastfeeding, and it's just not possible. Care obviously goes long beyond those years, though, beyond the first year of life. Time investments matter. We did in-depth studies. I'm just going to cite a few. In Botswana, Mexico, and Vietnam, you can see the numbers there, 59%, 42%, 49%, reported having serious troubles caring for children when they were sick. That meant they left them home alone when they were sick. They left them in the care of other sick children. This is a very large problem that we know paid sick days, if you won't lose your job, make a big difference. This is particularly important for young children. Older children with common illnesses may do okay without parental care, but the very young don't. This is what the map looks like. If you look at the world, you can see we've spent a lot of time talking about maternity leave, but just as we had a gap talking about dads, It's as if we think that parents care for the baby during the leave and then the baby just cares for him or herself afterwards. Unfortunately, that's not the case. So only 60 countries, about a third of the world, gives paid leave to care for your sick child to both moms and dads. So it's a very small amount. A few more give it just to moms. Pretty problematic in terms of gender equity. Most of the world doesn't give it to anyone. About 15 countries give unpaid leave. It was raised earlier that obviously parents have to be healthy themselves as well. We've come further in terms of giving parents who are working leave to care for their own health. We should care about that for their health, but it also tells a happy story that this is in fact possible. When it comes to paid sick leave for the adults, 9 out of 10 countries do this. Overwhelmingly, the world does it. I apologize that the United States still looks red. To anyone here from India, many Indian states do give it. It's just not given across the whole country. But the fact that we've achieved it for working adults, we should be able to achieve it for their young children too. Now, clearly we know income matters, and there are fundamental investments, whether it's in nutrition, whether it's in books, whether it's in other school supplies that parents need to be able to make. And a core part is where they're getting their income floor for this from. I hope we can start talking about the minimum wage as a way of investing in young children globally. If you look at how most parents exit poverty, they exit it by their work. Their biggest source of income overwhelmingly is their work. In terms of the informal economy, even though it's not directly covered by the minimum wage, the good news is most of the world has started to have a minimum wage, but I think while we talk about global poverty levels, we have yet to address the fact that in a third of countries, if you're a working adult earning the minimum wage, that will not bring you and your child above $2 per person per day. So if we want to reach that, we have to be able to let people work their way out. So fortunately, we're no longer in a global recession, or at least not at the moment. But the unemployment safety net has a huge impact on children. The most important thing I would say is that everything that's yellow or orange here are areas where, in the informal economy, where we know many of the poorest families are, there is no coverage during periods of unemployment for you. There's not an effective safety net. That's because the mechanism is severance pay. It's a pension you have to contribute to, and you're not allowed to contribute if you're in the informal economy. The blue countries are the ones that have solved this, but we should be thinking about that, and I'll skip ahead because of time and just say, we also have to think about intergenerational transfers. I'm sure many are familiar with some of the studies from Southern Africa showing when you give pensions, there are direct benefits to young girls and families. But we see these intergenerational transfers in high-income countries as well as low-income countries. So we should wonder what the pension maps look like. If you're a parent and your own parents are living in poverty, you are going to need to support them. But likewise, if you're a grandparent and you have income available and your grandchildren are in need, you're more likely to support them. So these really are not competing investments, they're complementary investments. So the one direct investment I want to talk about is tuition-free pre-primary school. So we were struck. We went around to find out how many countries around the world do give tuition-free pre-primary, and 43%, nearly half, give at least 1 year. That was better than we thought we'd find. That includes 5% of low-income countries. It's a small number, but they're showing it's feasible. And it includes the majority of, it includes the majority of high income and close to a majority of middle income. We should be starting to track this. We should also look at the outcomes and how it matters. This is the map of tuition-free primary. It's all blue. Nearly the whole world provides it. Just imagine going backwards that pre-primary map, when we next meet in 5 years, looked all blue too. So what's the impact of this? The impact, and for those sort of quants in the room, I'll explain that this is a hierarchical multi-level model that links it to household data. For those non-quants, I would just say what this does is it looks at the policies and say, did it change outcomes in 90 countries? And the answer is it did. It lowers infant mortality when you provide free primary. When those moms who had a chance at free primary become parents, then you have lower mortality rates. So I'm going to close for a minute by talking about critical data gaps and then turning it over to you all. There's much more we should know. One thing we don't have at all is data on the direct investments in 0 to 3. I showed you free tuition for pre-primary school, but all of the fantastic programs people have been talking about here for the past 2 days, and when we met in Brazil, we should be able to map those around the world. We should be able to help countries see what neighbors are doing. We should be able to link those to outcomes. That's feasible, but that data has not yet been collected globally. But we should also monitor progress, because it's only by showing every year when countries are starting to move towards better supports for families investing in their own kids that we can reward the policymakers and the leaders who are doing it and help press those who have yet to make change to make it. Thank you very much.
Well, good afternoon. It's a pleasure to be here. Many thanks to the organizers for letting me present our results from research, advocacy, and capacity building project related to child marriage that we started about 6-8 months ago. The reason why we thought this could be interesting to you is twofold. On the one hand, some of the most vulnerable young children are born out of girls marrying before the age of 18. And Jeff Edmiades from ICRW, this is a joint project with their team, mentioned yesterday that we have a lot of girls, it's actually 40,000 girls a day who marry before the age of 18. Their children are especially vulnerable. So child marriage has implications for investments in young children and early childhood development. Now, there's a second reason why I thought presenting some of our preliminary results might be useful to this group, and it is the fact that there are some parallels between what we're trying to do on child marriage and what the forum is trying to do on investments for young children. So the issue of child marriage is multisectoral, as is the issue of investing in young children. The forum has, as part of its mission, the idea of making a stronger case for investing in young children. We have, as part of this project, the idea of making a stronger case for fighting child marriage. But beyond the case, we also would like to try to identify some of the interventions that might be most promising, and the forum has that objective too, because one of the goals is to advise governments. Now, from my point of view, I cannot say enough, this is perhaps the most important thing. And we have a tendency in our advice, in our analysis, to be encompassing, comprehensive, right? At the same time, when governments make decisions, they have to be fairly selective, right? And not all policies matter in the same way everywhere. So to take the example of Jodi's presentation, right? I would agree completely that we need to provide parental leave when the parents have a child. And this is one of the interventions that we have identified at the bank as one of 25 key interventions for young children. Does it make sense as a priority for Africa? Probably not. Why? Because in many countries, less than 5% of the labor force is in the formal sector. And only through this formal sector, in most cases, can you provide those benefits. So other priorities are more important. For Latin America, it's a different story, right? So I think we have to really understand well what are the key gains that we can get, and then also what are the key interventions and prioritize. I mean, there's sometimes a tendency to be too comprehensive. Now, another parallel is that our program is global and country-specific, and then that we also have a desire to provide capacity building tools, including simulation tools, and I'll talk a little bit about that. So, why do we care about child marriage? Well, because a lot of girls marry before the age of 18. These are some estimates that we did at the World Bank. It's going down. This is for 60 countries. But if you look at the first line of that table, the incidence, you see that the share going down for those 60 countries has gone down by 10 percentage points in 30 years. The dates there are the dates when the girl was born, right? So it's going down, but very, very slowly, and you need direct interventions to try to make that go down faster. It also has a strong link with poverty and the most vulnerable. These are for a few countries, the incidence of child marriage by quintile of wealth. And you can see that, as expected, in the bottom quintile of health, on average for those few countries, the incidence of child marriage is 5 times higher than in the top quintile. No surprise there. But child marriage is really among the most vulnerable. Next slide. Now, when we started to try to think about the mandate, and the first mandate of this is to make the case. So what our funders asked us to do is to try to see what is the economic impact and the economic cost of child marriage. And so we reviewed the literature, and then we came up with this conceptual framework, which I'm sure is too small for you to read at the back. But essentially, we're looking at impacts on labor force participation, education attainment, participation in decision-making, violence, and health. And then we are trying to provide a common measurement, a common metric for those impacts through earnings and productivity losses, investments losses, and out-of-pocket costs. And now, 6-9 months down the road, actually we think that we forgot perhaps some of the most important things. What are those? Actually, demography is part of some of the channels there in the small letters in the middle, but probably the largest cost, economic cost of child marriage is through the impact on fertility, demographic growth, and poverty and GDP growth, and I'll explain that. Also, in terms of the way we measure the costs, some of the largest impacts of reducing child marriage, largest benefits, are not going to be through higher earnings and productivity for the girls who do not marry early and might go for more education and better jobs, but at least probably in the short term, the largest benefits from a welfare point of view are going to be the fact that you have to provide feeding and all of the other care that you have to provide to your children. You have less children. So for example, your per capita income or your per capita consumption is going to grow, and that's a gigantic impact. Finally, on the right side, we didn't have, when we thought about this conceptual framework, the budget savings for governments, again, in terms of service delivery in education and health. And we believe, or we think that these might be actually larger impacts. So why did I mention that? Is because we did our homework, and we had a literature review, and we had buckets, right, of impacts and then final costs. But actually, we forgot quite a bit, in part because there is less literature on those other topics. That doesn't mean that they're less important, right? And so we really have to try to understand what are the biggest impact, because that's what we want to observe, and then the best interventions. We have to be selective in the understanding of impact and of interventions. Next slide. So This I'll pass, next slide. The idea is that we are using existing data in the first phase and then detailed data for 3 countries in the second phase to look at the impact of early marriage on a number of indicators and then trying to put a dollar value or other metrics for the estimations. I'll pass on that because that's technical too. So I'm going to give you a few examples of impact that we have measured, right? So what's the impact of early marriage on total fertility rates, right? Well, using, for those who like technical things, Poisson regressions with lots of controls, what we find is that if you delay the age of marriage to 18, over the life of a woman, at least the childbearing age, you will reduce the number of children that the woman has by 1 to 1.5 child on average. These are very large impacts, right? So for countries like Niger, you might go from a fertility rate of, let's say, 7 or close to that to 5.5, simply by delaying the age of marriage. Now, next slide. Thank you. Now, what does that mean for population growth? I'll go to the next slide because that's too technical as well. So we estimated how much this would change the population growth rates of the countries. And what we did essentially, again, for those who want to know a bit more technically, is that we estimated in detail using Spectrum, the demographic projection model, how the growth rate of the country, including by age, would change if you were able to eradicate child marriage. And for a country like Bangladesh, this would mean that the population growth rate in 2013 would decrease by 1/3%, 0.31, right? Versus a counterfactual of a normal decline without specific intervention of child marriage over time. Now, the effects are a bit smaller in 2030 because child marriage is decreasing in many countries by itself. But then when we look at the cumulative impact, these are the change in the total population growth that you have for those countries from the eradication of child marriage. And they range for those countries between, let's say, 1.5 and 5 percentage points. So these are very large effects. And the next slide gives you an idea for the world as a whole. So the population growth for the world as a whole, at least countries where we have data, would go down by about 3 percentage points, right? Now, that's a lot. And if you imagine that every decrease in the population growth rate, for example, for the period between today and 2030 for the endpoint of the SDGs, the Sustainable Development Goals, right? Every decrease in the population growth rate is almost automatically an equivalent increase in GDP per capita growth because the adults continue to work and so on, might actually work more, right, because they have less children. That's a lot of impact in terms of quasi-income generation as well as poverty reduction. I'm not sure that argument is clear, but we can go back to it later on. Now, also, in terms of the spending for governments, next slide, please. I'll pass on that. Next slide. Well, I may not have a slide on that, but or it's later, but I'll mention it now. In terms of the spending for governments, the savings that you have on health spending and education spending and so on, when you have a lower population growth, are very large and could be reallocated to interventions for those children who are born and need services. Now, we also looked at a number of impacts on the key Millennium Development Goals targets. So this is an example for stunting. And so when we started this project, we thought, child marriage is going to have a very large impact on stunting, a very large impact on the under 5 mortality rates. Now, it does to some extent, but when we did the analysis in a little bit more details, we realized that versus the extent of stunting or the extent of under 5 mortality, the impact might not be that large. So why? So what you have here in the third column, called Marginal Effect, right, is for early pregnancy. If your child is born of a woman who is below 18 years of age, what is the additional likelihood that the child will be stunted that is directly attributable to the fact that the girl married young, right? So again, it's a regression. In that case, it's a probit, but we have different other versions. And you have a number of controls, including the years of early marriage of the girl as one of the factors affecting the likelihood of stunting. And you see in that column that you have marginal effects. So for example, in Niger, 0.059 means that the child is 6 percentage points more likely to be stunted if the child is born of a woman less than 18 years of age versus an identical child, as we can observe through the data with the controls, for a mother who was older than 18. So 6 percentage points, that's large, right? But if you look at the percentages of the births in the country, that's the second column, that are from those women, and typically it goes from 5% to 7-8% depending on the country, and the more child marriage you have, the larger that share, right? That marginal effect applies to those children. And so in terms of the total contribution to stunting, that's the overall effect, you might go to a half percentage points. That's still a lot of children, right? But that's not the most important driver of stunting in that case, right? So those effects, for those affected, are very large, but in the country as a whole, less large. While the demographic effects that I was mentioning before are actually observed for virtually all of the girls who marry early. Now, the next slide is about mortality. And if you look at the marginal effect, this is a different types of regression, so it's an odds ratio. And if you look, for example, for Ethiopia, right? A child born, again, from a woman below 18 years of age is almost 70% more likely to die before the age of 5 than a child born of an older mother, right? Very, very large impact. But again, only a small proportion, relatively, of the children are from mothers who are 18 years of age or below. Next slide. Now, on education, you have a little bit the same phenomenon, which is that for the girls who marry early, and for some of them, and let's pass on those slides because they're a bit too technical, you will have a much lower likelihood of going to secondary school or completing secondary school, and we can estimate those. Now, I mentioned before the earnings impacts of child marriage. And how do we do this? Again, I don't want to go too much in details, but the direct impact of child marriage on the likelihood that the girl, when reaching adulthood, will work or not work is something that is not so clear, whether that direct impact is large. But clearly, some of the girls who marry early would have continued their education, and certainly they would have had less children if they had married later. And the number of children, as well as the education, are key drivers of the likelihood of working and the earnings that you would earn. And so the broad messages here is that, again, for those, the impacts are very large, but globally, the impact is less large. So let me go to the next slides. This was the impact on health spending that I was mentioning before. Very, very large impact in terms of the reduction in the population growth and how that relates to the total budget that you need for providing health services. I'll go to the next slide. So, what are the summary of this analysis, right? So we are trying, in the first stage, to look at what are the key costs, what are the key economic consequences of child marriage, right? So, one aspect is this aspect of fertility. Very large impact on population growth, and thereby very large impact on the level of well-being as measured, for example, by consumption per person in the households, and very large effects on state budgets. The next one are the effects for the girls marrying early, very large effects for those. Distributional effects, and for example, for secondary education, if we want to think through who are we reaching, we have to be careful here, because the very poor, those who did only a little bit of primary education, will probably not manage to go to secondary. There might not be no schools, it might still be too expensive, or to complete secondary. So the distributional aspects for the girls marrying early, in the case of the benefits from a secondary education, are going to be more for girls who are in the third quintile, if you will, not the bottom, right? And something additional would have to be done for the bottom. Now, the next slide. For the children, very strong effect and very strong distributional effects. We are really talking here about some of the children in the most vulnerable families. Now, this does not represent, as I mentioned before, child marriage is not going to be the major cause of stunting or under 5 mortality and so on, but for those affected, the effects are very large. And then the government budget is a key point. Next slide. So, what is the message in a way in terms of the economic impacts, right? In the beginning we thought, the economic impacts, if you put a dollar value on them, are going to be largest for health or maybe even for education. And what we seem to find after the analysis is that actually the economic impacts are going to be larger for fertility. Now, I don't know whether we would ever have an agreement to do some kind of analysis to compare different outcomes in the case of ECD, but it matters. It matters because the gain that you're trying to achieve, the biggest bang, if you will, the 80% of your 20% of interventions or whatever, we need to understand what that is, right? Even though we want to do something also somewhat comprehensive. Now, in terms of interventions, you can have different types of interventions to reduce child marriage, and I don't have the time, I think I have 2 minutes left or something like that. But probably what I find interesting here, just as one key message, is that in terms of intervention, the intervention with the biggest benefit is not directly related to the largest economic impact. So I still believe that the largest economic impact is through fertility, right? But the intervention that is going to have the largest impact is probably continuing of education and providing some meaningful alternatives in terms of job opportunities for the girls when they are in adolescence or later, right? So the intervention is not related, the interventions with the largest impact is not necessarily in the field or in the sector where you have the largest economic gain. And I think that's important, right? That we also need really, as part of the forum, to try to identify the few interventions, depending on country context, that are going to have the largest impacts, and they're not necessarily always related to how those impact transfers into benefits for the families, right? I think that's an important concept. Next slide. Conclusion. So, very large impact of child marriage, and that's, in a way, if you will, child marriage is an investment decision by the family, right? When the girls get married, that's largely driven by economic factors, right? Large impact of that on the children from those, even though they are a small set of the overall children. Children born of young mothers among the most vulnerable. We need to change the local marriage market and the gender roles, and probably a combination of economic incentives with empowerment programs, economic incentives especially for education, and empowerment programs especially for work, are going to be the best interventions. Now, in terms of the timeline, we are using existing data right now. We'll go for 3 in-depth country studies in the next year. And on capacity building, we have exactly the same question as the forum has through some of the workshops that we had before. How do we develop Excel-based or MATLAB-based or whatever it is, tools that are sufficiently simple but sufficiently realistic and complex to represent reality that countries could use to both look at the economic cost and some of the interventions? Thank you.
So I'm going to give a little bit of reflection on what I've had. So one little correction. When the panel started, they said it's a panel of experts. I'm not really an expert on policy. So what I'm actually going to do is just give a little bit of my thoughts, having had this discussion, and what will actually kind of define my reflections will be the area I work in. So just a little bit of background. I work in a very rural area. It's the 2nd poorest district in Kenya, you know, so low literacy levels, it's improving, but still very low. And, you know, as Quinton was talking about child marriage, I remember we had in-depth interviews, and we went to community leaders to ask them about some of their, you know, challenges and their worries. And one gentleman told me their biggest problem at that moment is that their girls are reaching 23, 24 unmarried. What's becoming of their society? So this was really, really worrying him. So this is the context I work in. Next. So just a little bit of, Jody has identified a really good set of policies that support families. But in a context like the work I work in, area I work in, most women are in informal sectors. We call them mama mboga, the woman who sells vegetables, the woman who, at the coast where I come from, we are very good cooks. I'm not one. But, ladies cook and sit outside with their buns and potatoes and sell. This is how they make their income. So paid maternity leave or paid paternity leave will not help these people. And what's even more important is that they stay at home. So we might assume actually they have time. They don't have time. One mother once told me, you're telling us to play with children. I wake up very early in the morning, walk 1.5 hours to get water, bring it back, walk another 1 hour to get firewood, bring it back, then go and farm, and come back to quickly cook for the children so that they can go back to school. Then I go to wash, clothes by hand. So her whole day was full. She gave me her schedule. So these women in the rural areas actually need nursery schools. They need help. They don't have time. Paid maternity leave and paid paternity leave will not benefit them. So they need policies tailored to the informal sector. Next. But I also work with families with children with disabilities. I remember once I read a very interesting article, a mother who said that when she got her child with a disability, it was like taking a plane, trying to get to Amsterdam, and you land in Iceland, and you can't leave. That's what you've got. That's what you've got, you love, and that's what you have to take care of. And it takes more time than what you had initially planned for. Because there are some children in our context with severe disabilities, they need a lot of extra care. So policies that take into considerations families that need to give extra care to their children need to be highlighted and need to be discussed in more depth. Next. So Quinton has talked a lot about this. I saw this interesting title, Motherhood in Childhood. I have talked to some of the parents in my study, and I asked them, are you sure you're 17? And she says yes. And we all know she's not saying the truth. She's just 14, but even she's feeling a bit embarrassed to admit it. And Quinton has talked about early marriage. But of course, there's teenage pregnancies, And what happens is that policies that are based on paid employments cannot reach these teenagers because they have not yet gone into the job market. So as Quinton has highlighted, we need more policies that prevent motherhood in childhood. That means that girls getting married very early, but also teenage pregnancies. How do we deal with this? How do we tackle that? But there's already also a lot of mothers who are teenagers. How do we support them and empower them to be able to become independent? This shouldn't be like a life sentence, that you got married early or you got a baby early, and therefore you can't achieve your potential. So, policies that try to empower girls who had children early, I think those are the kind of policies that could be advocated for more and highlighted. Next. So this is just something that probably I'm preaching to the converted, But what Quinton's topic brings very well is that early childhood is just the foundation. And if you're going to build a good house, you don't put a foundation and go away. Next. So that shows just a bit of academics, but brain development goes on all the way to early adulthood. Very important skills are achieved in adulthood and in adolescence and on. So as advocates of early childhood, we should actually say that early childhood is the foundation. You lay a good foundation, you need to build to the end, to have a good house. And if that doesn't convince those who are really, really into early childhood, I would say that adolescents are the parents of tomorrow. Hopefully they wait until the right time. But if we are thinking of starting early, then we shouldn't actually start when they're pregnant. We should prepare the parents of tomorrow early enough, ensure they're healthy, they're protected, they're well educated, so that when they become parents, we don't have to come up with fancy interventions. Thank you very much.
And the panelists an opportunity to respond to each other, if you would like to.
Thank you. First, it was really great to hear what you had to say, Amina, and Quentin, to hear what you had to say. There are a couple things I'd like to say, because I think we often generalize about all our countries in ways that don't necessarily hold up to what happens when you interview families in depth. And I'll just give one quick anecdote and then go to the informal economy and the leave issue. So when we first started doing our global work and we went to Russia, they said, you know, really these aren't issues for us because there's so many extended families and everybody has a babushka. And I said, yes, great, I have a babushka, but we looked at the data and the national data, because I did have a Russian grandmother, and the national data, in fact, was that the majority of families didn't have access to extended family. We heard the same thing when we went to Botswana in southern Africa, and then again, we used national data, and when you looked at who was in households with a non-working adult who was healthy and could help, it was more than in other regions, but was still a minority. So I think sometimes the big generalizations we think about for all our countries don't necessarily hold. In the United States, the argument is that you don't need paid leave because all the companies give it. The data shows they don't. So now I'm going to get to this question of whether paid leave is a priority. My sense is that there is huge community-to-community variation, and I agree, Amina. In the rural communities, it's not the highest need, and making water nearby and fuel nearby would probably do more for time. But in terms of country level in Africa as a whole, those statistics I showed you about the 10% reduction in neonatal mortality, those are largely driven by African countries, because we've looked at separately for low and middle income countries, and the countries where the biggest increases have occurred are in African countries. So I think we all need to look deeply at some of the generalizations we have about our countries and realize that there may be more diversity within a country, or at least as much as between. So why does it work? And the quick answer is, it works because in many countries it does cover the informal economy. It can if it's a social insurance system. It goes directly to people regardless of whether they're in the formal economy. Think of it like a cash payment. And the second reason it works is families share money. That having been said, I just want to close by saying, I think your overall point, Amina, of the importance of looking at the informal economy is a very big one. And we have a whole initiative undergoing now to look at laws around the world and see to what extent do they cover the informal economy, and that's crucial. And we do have separate work on children with disabilities, and I'm sorry, just because of time, I didn't present it.
Okay, so maybe just my reaction to that, I think the issue of paid leave, from my point of view, it shouldn't be one or the other. It should go hand in hand. Mothers who are working deserve paid leave, and I think it's really crucial. But what my point would be is that we need also policies adapted to those who are not getting paid employment. Okay. Oh, okay, sorry.
Of course, I believe we need paid leave. Of course, the World Bank believes we need paid leave, right? The question is, for every particular country, who is it going to reach? I think the point I was trying to make is slightly a broader point, but also for this forum, actually. It is that depending on context, and many low-income countries in Africa are very different, of course, from Latin American countries, right? We need to find a way to identify those policies that will achieve the largest impacts with respect to their costs and their reach. And so if I take, for example, some of the policies that Jody mentioned, the question, for example, of free at least 1 year of preschool education and the ability, which is currently in Africa absolutely dismal, for the government to have the service provision infrastructure to provide that, to me, would probably have a much, much larger effect than some of the other policies, right? But so what I want to try to poke a bit here is to what extent are we able, in the tools that we provide, in the advice that we provide, to really set up priorities on 2 or 3 programs that government can implement at scale, as opposed to a wide range of interventions that should be beneficial. We have defined, as many of you know, for example, a number of interventions at the World Bank that we believe are fundamental, including paid leave, but we have stopped short so far of trying to have clear typologies of countries with clear recommendations of which ones should be implemented in which country at which point of time, depending on context. And to me, that's where the frontier of what we have to do lies.
Thank you. We're going to open to questions. And there's one in the back, the microphone, and we would like to take a few questions before we answer. And when you ask the question, if you can say your name.
It's to all of you, but it's more of a comment, and it does concern the paid maternity leave. I think that if we look at early childhood development, it does combine the emphasis that we are all aware on the first 1,000 days and its critical impact on infants. So I think we have the ILO convention that stipulates 14 weeks, and we know why this should cover also exclusive breastfeeding. We know that the convention also gives moms who are in the formal working sector, there is a recommendation to allow them to stay a little bit longer at home. And we also know that from both perspectives, if we look at statistics on breastfeeding, we know that it clearly supports extended breastfeeding with all the other implications on early childhood development and mother and child. We also know, and I was at Nestle and we did some research, and we know that it diminishes mom's attrition, and sometimes it almost diminishes the cost. So the impact on long-term economic benefits for the family or the mom, sometimes from economic point of view, are also extremely valuable. So I think given all of this, I understand governments will need to prioritize, but there is a convention, there is data, and there are effective legislation that are already in place for years. So I just want to support Jody in that sense. I think it's a critical place to start with early childhood development.
Thank you for your comment. Right here in the front.
My name is Leonard Chumo, International Child Resource Institute. My question goes to Wardon. So I totally agree, and I think it's the way forward to improve on policy and invest in early childhood by fighting child marriage. But I needed your comment on looking at the condition in sub-Saharan Africa. So the children that are marrying early, and I know you men, girls here, I would be happy to see the perspective of boys also getting married early. But the condition in sub-Saharan Africa, we know that there are initiatives and advocacy to reduce child marriage and female genital mutilation. And there is a cost of investment into that advocacy. Are the girls marrying early out of school necessarily, or those that were not in school? And either way, what would be the ratio? And I'm trying to relate that to, should we invest more in ECD rather than advocating for children who should not marry early, and divert that resource into ECD, and perhaps the numbers would go down?
Thank you for the question. Any other questions? If not, I saw another hand on this side. Yes.
My question is directed to the early marriage or child marriage. I heard this as an issue before 15 years ago. Still today, the issue is the main among the developing countries. The reason of the early or child marriage is obvious, it is known. For example, in Ethiopia, economic survival and independent from labor force of parents is the main reason why early child or early marriage is scattered. Maybe it needs more investigation to work on the parents. This is the grassroots of the cause. Economic survival, need independent from workforce or labor of the parent. Still, the main problem is with parents working at the grassroots level is what I have seen more than 15 years. This is what I have in the workshops.
Thank you. So if you would like to respond, and then we go to see if there are more questions.
Right. So on the question regarding the impact of early marriage on education, there's also an impact of education on early marriage, right? So one of the reasons why I mentioned at the end that more secondary education as well as skills training and opportunities for the girls to actually have some livelihood can help in delaying early marriage, is because the estimations and some program evaluations suggest that, right? Now, if you ask the broader question, and I think you did, but I'm not sure I understood well, as to, for example, what's the share of the total dropouts of girls in secondary school that is due to early marriage as opposed to other factors, different types of estimations with different types of data suggest that this would be perhaps a fifth or a fourth. So it's not the only reason, there are a number of other reasons, right? So I'm not sure I answered all your questions. Then you asked another question, which was, should we invest in ECD or preventing of early marriage, right? So there are difficult choices. From the point of view of ECD, one thing I want to make clear that the data that I showed actually suggests is that in terms of the impact of your interventions, if you are going to target the children of mothers who had these children below the age of 18, because the risk factors of those children are so much higher in virtually all areas, including stunting, mortality, probably even the ability of the mother to have autonomy and early stimulation, that actually is potentially, depending on the community, a good way to target interventions and have a larger impact, right? And that refers a bit to what Jeff was saying yesterday with one impact evaluation in Ethiopia of interventions targeted at young girls below 18 who had children, right? So it's a double kind of implications for this group, right? One implication is that the prevention will help reduce to some extent some of the issues we face for the children, but then if you don't prevent, as important is some of the targeting of interventions to those groups, right? So I think we have to keep both in mind. And then, sir, your comments, I think, point to the fact that it's extraordinarily difficult to change the dynamics of what is going on in terms of early marriage. It depends on gender roles, and that's why there's no time to discuss it here in depth, but you need to have the more economic aspects or incentives together with a dialogue at the local level. And there are a number of programs that are being implemented, not only for girls specifically, but also at the community level, and that shows some promise in that area. So you need both. You need to change some of the attitudes, and you need to have the economic incentives as well. So on the paid leave, maybe nothing much, but just to say that, again, I believe it's very important, right? But if you're in a country like Ethiopia or Niger, Niger would be more extreme, where perhaps 5–6% of the population is in the formal labor force, they don't have paid leave as a mechanism to reach those girls who are the most vulnerable. That doesn't mean it should not be done, it should be done, right? But the question is, the interventions that we choose are really country-specific, as Jody actually said, right? And we need to make the inventory to know what is happening, but then we need to really prioritize.
Thank you. Do any of the other panelists would like to add?
Okay. I want to just make a quick comment on early marriage and why it's a long discussion. So if you ask me for data on this, I don't have. It's largely my perspectives on living in these communities. And I would say it's really an interaction between economic factors and cultural values. So I think investment in ECD will not stop early marriage, because it's free, the children are not yet ready to get married, so parents will take them to school. I think what I get as an impression is that when it comes to secondary school, when a father has to pay a lot of money, then they have to make the choice between their girl, who when they get married will go to another village, and the benefit will go to that village, and their boy, who is assumed will get a job and build their names. Then they will invest in the person whom they think brings them the most benefit. So actually, if you ask me, I would tell you, give girls free secondary education. You know, so if they don't want to invest in their girls, let them get a free secondary education. It's no cost to the family. And then there is a problem of role models. I work in communities where no girls were educated, and they don't see the benefit in educating them. So if girls got more education and they came back to the community and the community saw the benefit to it, they'll be willing to invest in it. I know recently there was a discussion in Kenya about cows for girls. So there are communities where fathers marry their girls very early for cows. And one governor had said, why don't I just pay these fathers the 7 or 10 cows and tell them, don't touch these girls again. Let them go to school. So it was a discussion around that.
So first, I very much want to second the notion that free secondary would be a great intervention, and we could have a long conversation about that, but I want to build on Quentin's notion of evaluating priorities to add the notion that we need to evaluate what works. So Quentin gave us great data on the relationship of child marriage to outcomes, but there's a second whole piece, which is actually evaluating which of these policies lead to the most change. It's not always what you would expect, but I think what the national and global level data allows us to do is see when you have a good idea like free secondary or compulsory secondary, but that has real costs, what is the impact? Let's follow what the impact is in countries that put that in child marriage laws. We can now do that. Last point, low-hanging fruit, low cost. 60 countries around the world allow girls to be married off younger than boys. Most child marriage is girl marriage. If that was leveled up, it'd be a start. Not sufficient, but a first step.
Thank you. It's time to end. And I just want to say that something that was very instructive from this panel is the idea that the policies that are needed to ensure that parents and caregivers have the time and financial resources to invest in their children. And also that in addition to the investment in early childhood that we all support and really believe in, there's that stage of adolescence that is also key and has unique needs and challenges and also a lot of assets that we really need to also pay attention in order to impact also early childhood for if they have children in adolescence or when they are parents at an elderly age. So I just want, please join me in thanking this amazing panel.